until those individuals feel like that they don't need those, like that communication.
Okay. And so can I put, again, increased need for suicide support, and then increased need for, I don't know what you call your programs for alcohol support.
I would just, yeah, probably, we could probably do, because alcohol, drugs, and mental health are almost hand in hand. So we could just say something about just treatment in general.
But it would be increased, or is that incorrect? I keep saying that, but I don't know that I've heard you say that.
Increased during?
Yeah, the drought because of the stress or because of.
Yeah, it would probably like the availability or the need for services would probably increase during the drought.
Well, I think that at this point we can safely say no. And also, yeah, it's the same tiny segment of the song.
Do you have things that you would like to add, specific programming or services that for you all?
We do kind of have a service that's Healthy Families in America, which I feel, and that might affect a little bit because that specifically focuses on children, but I think a lot of those families have parents who are hired hands and things like that for farmers, and they might have that, and they deal with the same substance things that would go along with this stuff. So we might see an increased need for more families on that program.
Okay. During.
Yeah, I would say during.
Post.
Yeah.
Should this one be taken into post also? I'm sorry, is it Healthy Families?
Mm-hmm.
What were the services?
They do childhood welfare basically.
Okay. You had mentioned that you do grant writing for your projects. How do you see that being impacted by the drought as well?
It would depend on the program and the grant we're writing for. I think if it was, I think during and post it would affect the type of funding we would get if we were writing for grants that were related to Drought. But at the same time, a lot of our grants are federal and then state grants, and so it just depends on what's going on at the federal level as well, whether or not they pull funding from certain programs or they just cut funding from different levels. So I mean, even without taking Drought into consideration, it just depends on what's being done at the federal level.
They could actually potentially have a new source if someone decided to drop it a huge issue.
Right.
You mentioned private groups and also we work maybe at similar to this. If you consider that work and how maybe they might fit the program, are there additional ways that Drought could impact them that you would want to add? It seems we're trying to get a broader sector-based understanding of what public health and behavioral health and political might.
Well, I think within the private sector, you probably see availability go down if more people start utilizing that service.
Availability of services.
Which would then, because when we get folks come in, to the region, we refer to our providers, and then if it doesn't fit, we refer to private sectors. I mean, we just can't pay for that, for that service. But if we see an influx in individuals seeking treatment or seeking therapy, it might cause an availability shortage, just because you can only, somebody can only carry a certain caseload at a time. But that doesn't take away the fact that we could probably contract with other programs across the state. Where you get into issues with that is if we have a higher need for those folks to go out of our region, then it drains our funding pool. So then we'll run out of money faster for those types of programming or for those types of contracts.
But because you would pay to have them transported, or
right? And so what we do is if somebody has no insurance or is denied Medicaid, or they don't have a funding source, the region is the last line available to pay for those services. So if somebody needs a higher level of care that we can't provide in our region, and if they have to go to another program, like say in Lincoln, our region has to pay for that person to go to that treatment. And there's depending on what they need and how long they need it, we have a table that we base our daily rates off of. And so it can be anywhere from $116 to $220 a day, plus transportation to get them there and transportation them back. And so if we're sending more and more people out because our providers are full and the private sector is full, then there goes into that availability again and the utilization of funding. Whereas if ideally we want to hit zero every year with our funding, but if we're using more, how do we pay for those if we run out and we don't have our new fiscal year started? I'm sorry, I'm pretty long-winded when I answer questions. It's not
That's good, I'm just trying to break it down and phrase it out, might be appropriate, okay. So we could put, an increased demand on, services outside of the district, because you're outside of your district, because you're going to have to be transported.
Right. I would just say, like, even during, you could see an increase in service demand.
Right, and that we have kind of at the bottom down there. So, and I guess I interpreted that as increasing services within your area here. So would it be, like, I was trying to distinguish between that demand on services in your district and then what you were talking about having to send people to Lincoln, or outside.
Right.
Is that accurate, or is that?
No, that's accurate. It's probably, I probably just explained it the same thing, two different ways.
Okay, so, I just keep going back to, you were saying when, if people had to start going to the public sector and if they were really overwhelmed, then that would lead to a shortage of services in general. And the way, I guess, that one over there, the way I phrase that one is, more are you offering the service, but now
Well,
we're talking about, can people get into it?
Right. So when we were talking about that, I was just thinking within our own provider base. And then as I was talking more, I realized that we still have access to like private practices throughout the Panhandle.
Sure. I can put region 1.
I would, yeah, if we
Specify
specified it,
that.
because we can only refer, we don't really have a lot of control over that area.
Just go on into post the.
Yeah.
Is the funding you were talking about having to use funds to get people to other services? Should that be on here as something different than utilization of funding? Should that be like reallocation of your own funding?
No, it can stay over there.
Is that okay? Melissa, do you have, what other types of organizations in this area would be concerned with these topics?
Definitely the hospitals, I think, would be a big one. And I think any kind of health related organization, it doesn't have to necessarily be a hospital, but because we're so rural, we have rural access points, but we don't have major hospitals. And something I guess I was thinking was this quality of life for us is a big chunk of what we do is worksite wellness. And I think people's access to certain things might suffer during a drought, like he said, but I think I'm thinking more of food and water and things like that, and kind of your quality would decrease on that for us, please.
Okay, so, do we just put, should we distinguish between quality of life and access to food and water as two different things? Are they the same thing? Or should quality of life be written on here, but then explains all of the components that will go into that?
That might, because I think they all kind of tie into quality of life, and they can help part of it, and then how you're living your life.
And then what are all of the components that you would put in quality of life?
So I would probably put it, healthy food access, and I think we have water quality listed on something too.
Okay, water quality.
And then I think ours would tie into the behavioral health, because then you also need to have, references to people who do have behavioral health issues or who have just regular health issues. You need to have access to those, and this might decline, like you said, if there's no funding for it, or if the hospitals are full or something like that. That's part of your quality of life. So, I don't know if you want to just put healthcare, maybe that would be it.
Yeah, healthcare to me, I guess. So if I add here, mental and emotional, state or
Yeah.
status, and then add healthcare as in like access to healthcare
Yeah.
also?
I think so. And it kind of ties in what we were doing, so.
Okay. And if ever I throw something back at you that's completely inaccurate, just say it, that's not correct. Healthcare, mental and physical, the other aspects of
Probably the biggest ones.
should those extend here into after drought,
Yeah,
both of them?
yeah, I think so.
What easy topics and other topics for this one? I don't know if these are, I guess, sort of at an organizational level. If there's any more specific ones that would affect your everyday actions. We will of course pertain to that, but you know, come to the office and start your daily routine and go right to the. Did I find that flash drive, snippet from the drought planning handbook that talks about, yeah, the public health impacts? Include that in there to help us brainstorm if there was anything else that, maybe we were missing.
Should we keep scrolling? What do you want?
There at the bottom of the second paragraph where it says, exposure to toxic substances, or we talked things about water quality, and so we refer most of those to outside organizations. Or if you do work with sanitation.
Not necessarily. A lot of the calls I get, they're mostly for rental properties, and in that case, that's something that refer them to the renters' rights and things like that. And then, like a food issue that we have the state's health inspectors do. So we don't necessarily deal with anything like that, but other sectors do. So.
Would you expand on that a little bit? The calls that you mostly get are from renters.
Mm-hmm.
They are calling you about situations with their living conditions. What's usually going on with that kind of thing?
A lot of what I get is they'll have mold, or they'll suspect they have mold, or there'll be some kind of infestation in their house, and their the person they're renting from isn't doing anything. Okay. Yeah. And in that case, they do have rights, and I refer them mostly to housing and urban development. And then we do have Nebraska legal aid, but they're very full right now. So, but I do try to just tell them it's your right, and this is what needs to be done. It's usually all we can do.
Did you still put that on this list for this stuff? Even though it's the same referred to someone else, you know, that too, like the more local in-house increase cases of infestation, roads, services.
Yeah.
I don't know if this is scientifically legit.
It may be.
Okay.
Yeah, I can construct in my head scenarios in which that would be true in a drought. So, yeah.
Mice are very resilient, so
They are.
Something I'd be worried about.
And the disease incidence in mice goes up when they are also exposed to stress.
Right.
So then they're bringing that into somebody's house.
Mm-hmm.
gonna go on into post-drought.
I think for a little support. So we can get the situation under control, but
It's been very accurate.
Well, and we aren't really, even when we're extending these, we're not really distinguishing between like short-term and long-term.
Yeah.
So it could extend for a couple of weeks into post and that still counts.
Yeah.
see something I mentioned on there about those living below the poverty line. A lot of lectures and things that I've sat in on that specifically talk about huge climate change issues is the people that suffer the most are the ones that are right below the poverty. And those are the big need groups. Those are the ones that are disabled or have mental issues or things like that. And I think the drought would really burden a lot of people that are living below the poverty line. And we do have quite a bit of that.
Okay, and that's, should we go ahead and for all of these issues that we've identified, associate it with the specific population? So, mental health stigma is what population is to put down. So this specific thing affects that specific, and if it's everyone, then that's good.
I think mental health stigma is with everyone. I mean,
Actually. And utilization of funding.
well, see, funding wise, if somebody has, I think that would affect those at or below the poverty line, just because where that becomes an issue is if somebody doesn't have insurance. So if somebody doesn't have insurance, that would affect our funding.
It affects how much funding you get.
Well, it affects, so I guess it doesn't affect the funding. I think it would probably fall underneath the need for treatment services or increased need. Yeah.
Okay, and then you want me to put people out of below poverty?
Yeah.
This one, and maybe again, I'm still not understanding you on what you meant by utilization of funding. I guess I
I think we just, I look at it as like, say this, so let's say this year we use 25% of or we use everything for 25% of our contract, which, that's a high amount. But then for the next year, they only give us that much. Well, then that next year, a drought happens.
Yeah.
I mean, so that's where that pre thing comes in.
right, and so here, then would we put like your specific organization? This aspect here is going to affect you all first.
Right.
It's going to affect your services, what you can and can't do.
Right.
Is that, you said that's not exactly the case with yours?
Oh, well, it could depend, because it depends what the state gets, because a lot of our funding is from tobacco settlement, so that could go down, and that could affect a lot of our funding too.
Okay. Is that accurate, service organizations? Would you rather?
No, I think that's accurate.
Is there a sunset date on the tobacco settlement money? Do you know?
I'm not 100%, okay, but I know they keep trying to, they want it units off of it
Sure.
eventually, so we're self-sustainable, but
Right.
I don't know when that exactly is.
Okay, just curious.
Air quality.
I think that's everyone. It doesn't have to necessarily just be single property.
And if you want to add groups that it would impact more, even if we say everyone, if you want to specify this, our populations that would be impacted more, I think we could put more in one distinction. Availability of services, in region one, so within the location of region one, and then services that you all are able to.
I would say add it below the poverty line.
Increased need for West Nile. Everybody.
Ideally, everybody.
Okay. Yeah, maybe you said this, do your own live work, or does that get sent elsewhere, or what's the question?
The mosquitoes get sent to Lincoln, and then if we have a case where someone places suspect has West Nile, that is us. That's on their side. So they don't do blood testing, but we do have to, they have to contact the public health nurse before they do anything with the West Nile.
Should we put, West Nile itself, like the incidences of West Nile as a separate factor? Because here I was looking at, well, this is going to be more stress on your organization, it's going to be stress on whoever tests for it and whatnot. But then if you put West Nile as there's more cases of West Nile, more mosquito more, then that sort of looks at different populations, maybe.
Yeah, that would probably be more poverty line as well. Because what they find is a lot of the areas that are troubled by West Nile or Zika, they're ones where they don't have the money to spray or have preventative actions. So they're exposed more to it than people living above the top.
Increased need for healthy families, child welfare.
That one I think would be more targeted to lower income poverty line.
And possibility of a new funding source.
That, I mean, that could potentially affect everybody.
Increased demand on services outside of.
Probably more on the low end, so the poverty line, at or below the poverty line.
Can we also put like those organizations that are outside of your business, they're going to rely on everything, the external service providers,
Right.
external to the one. Availability of private sector behavioral health.
And that would affect everybody.
Quality of life, healthy food access, water quality.
I would say that's everybody.
Access to health care.
Yeah.
Increased instances of in-house sex.
That one would be more for individuals.
Increased diseases in those sites. Again, any topics that you thought about this first round that either activities or the service populations that we
Well, I think like, I just think pre, during, and post, there always can be some form of educational piece, whether it's outreach or, public service announcements or whatnot. Obviously, it's gonna change based off of what happens and what's going on. But I feel like, especially like with droughts, we have the technology available to kind of prepare for it or know if something's about to happen, just based off of weather patterns and whatnot. So that could be partnered with the mental health, that piece of it, and just kind of putting out those, hey, so in the event of a drought, or if your stress starts getting higher, we can start doing those pieces as well. Because it's obviously it's going to look different if if a tornado happens. We can't really predict when tornadoes are going to happen, but I think we have the technology to kind of prepare for a drought, and help them not only with their mental well-being, but have them make sure everything's in place in the event that a severe drought does happen. So having them talk to, and I say them, I'm mostly talking about like agricultural folks, getting them talking with their insurance, with their lending folks. Because I just think back to the drought tournament that we did in November, and how my table had farmers and lenders, and that was a big piece of it. It was making sure that your insurance isn't going to go away if something like this happens, or if you're, knowing I'm not a farmer, so like knowing your land's worth and whatnot, just having all those pieces together while at the same time paying attention to yourself as well. We, from a behavioral health and mental health standpoint, we could help with that promotion of that. And it wouldn't be a strain on us, regardless of what happened.
How do you see that? How do you see implementing that? If you were going to help with that, what would that look like?
I think it would have to be done collaboratively.
Okay.
I would say with any and all organizations that are going to be directly affected.
Okay.
Because I mean, we can put up, I mean, we can put stuff in the news, or we can advertise certain things. We can put up billboards, but unless we're really like hitting all the points down and not just having it as a broad message, I think it would be more effective.
Mhm. So with the, in terms of organizations that are involved or affected, are you thinking about like lending institutions and insurance companies?
Yeah.
That kind of thing?
So I think ultimately it would affect everybody.
Sure.
And so I think the more we have available to us to help promote that message, I think it's going to just be better.
The more information,
I think the more
what is it?
information and the more information we have, and the more it's being talked about, I think is going to would help us get those ideas out there, and we go back to that mental health stigma. Because if John Doe was talking about it, well, then we know it's serious, and so I should probably.
Mm-hmm.
And so it I just view it as it doesn't hurt to talk about it.
Mm-hmm.
And the more we talk about it, I think it might open it up.
Okay.
Yeah, we try to do a lot of promotion and things for people if we feel like there's a big need for it. And I feel like if it was something we were trying to stress free, I would talk to you guys. I would say, what exactly is it that you want me to tell people in terms of water quality or saving their water, or what would you like, where would you like me to lead them so they're going in the right direction? We can help you do it. We just need to know what you would like us to put the word out for.
Okay, so you see collaborating with the NRD to frame the message and the content,
Yeah.
and sort of well, not necessarily the audience, because we would sort of want to tell everybody.
Yeah.
As being part of that,
Mm-hmm.
at least part of a way of trying to address some of this.
After we talked about outreach and education, the coordination of, this should be up there, the coordination of the outreach and education with Drought and and then promoting sort of those actual activities for preparedness. You talked about the insurance and knowing where you stand, along as a means of being more mentally, behaviorally stable, because you have taken care of those kind of things, that and prepared.
Right.
That okay. And then should I make a separate section for not only the coordination of information, but collaboration between organizations who would need to do that type of coordination? I guess to me, I see that collaboration would come first in order to coordinate.
It might go with your outreach because,
Okay.
because it all kind of, we would find out too who, if we needed to refer people to like healthcare or insurance, things like that.
Okay.
So I think it all kind of goes together.
So maybe for collaborative outreach and
Yeah.
education. Okay, and then how far should each of those extend?
The collaborative outreach and education would have to go all the way
Mhm.
across.
Probably same with coordination too. I don't know, I think promotion would probably, you could go during, but you really want to hit it beforehand, like, I would think. Yeah.
What population should I put with each of these?
I would say everyone,
Mhm.
for every single one. Yeah.
Mhm.
Okay. You guys want to take a 15-minute break, and I will do my best to quickly type these up.